want to bring in NBC's medical correspondent, Dr. John Torres.
Yeah, Dr. Torres, we're watching doctors and nurses basically on bended knee pleading with people. Like, if you're not going to do it for yourselves, do it for us. And I can feel them wondering, like, is anybody listening?
And you're exactly right. That's what I'm hearing from my friends as well, is they're saying, even to the point where people are getting intubated as they're with their last gasping breath, are saying, I don't believe this is coronavirus. I think this is the flu. Why are you guys doing this to me? Or they're saying, I should have listened. I should have done these things that we know we need to do. And the concerning thing is, this is going on for like 9 months so far. We still have many, many more months to go with this. And everybody working in the healthcare industries, doctors, nurses, health techs, they are tired. They are overworked. They're overwhelmed. And psychologically is taking that toll as well. And that's important. We have to remember that as well.
And the nightmare scenario is before us because Thanksgiving is coming. And again, these doctors and nurses are saying, please don't go outside your household for Thanksgiving. There's a Washington Post editorial this morning from governors, both Republicans and Democrats. It says in part, if you're planning to spend Thanksgiving with people outside your household, we urge you to reconsider. Think about your last Thanksgiving and the people you were surrounded by. As hard as it will be not to see them this Thanksgiving, imagine how much harder it would be if their chairs are empty next year. Dr. Torres, for folks who are still on the fence this morning, how dangerous is it to try to gather people together, even extended family, for Thanksgiving?
It's extremely dangerous. You're gambling with your family's lives, and I get it. We all want to see our family members. This is the time of the year we like to gather with them. I had to tell my sister and my nephews, no, do not come over. It was one of the saddest things I've had to do in a long time. But at the same time, I want to make sure everybody's healthy. And I know for most people, we're seeing the light at the end of the tunnel. We're hearing about the vaccine coming. You need to take those extra measures because even though for most people we are seeing the light at the end of the tunnel, for healthcare workers, it's deja vu. We are doing the same things that we were doing months ago. We are seeing more people hitting the hospitals. We are seeing these human behaviors push people into these healthcare situations where they need this attention. And for healthcare workers, it's adding stress. They have to go home to their families. They have to put food on the table still because they have to work. It's one of those things that just keeps on adding to itself.
Right.
And there's no light at the end of the tunnel for them, unfortunately.
You know what, Dr. Torres, back to Thanksgiving for a second. I think a lot of people think, you know what, I'll go get a test and then I'll be fine to sit and enjoy Thanksgiving. But there was a doctor who we just saw who said you cannot test your way to a Thanksgiving Day table.
I agree with that exactly. That test only gives you an idea of what's happening that day. You could test good on Wednesday, be positive on Thursday for Thanksgiving. You don't want to use the test as your free pass.